what is the meaning of big data, how the big data modeling can be related with breast cancer, and what is the contribution of this project to the world of oncologists. So Assalamualaikum and a very good morning I bid to Dr. Nur Aniza and fellow friends. So today my partner and I are going to present our progression of proposal. Before I proceed with the presentation, I would like to introduce myself. My name is Irfan and my partner is Zahin. As you can see on the board, our project title is Big Data Modeling in Breast Cancer Radiotherapy to predict the lung toxicity. This project is being supervised by Dr. Noraniza Azmi and co-supervisor is Madam Khadija and Dr. Nuliana. Okay, to answer what is the question, what is the meaning of big data? The definition of big data in general is it is a large set of information which can be collected and summarized into a useful set of data that can be used in healthcare services. So Zain, can you share with us what is the importance of this project?
Okay, the reason why we need to use big data using artificial intelligence approach is because to predict the toxicity caused by the radiotherapy treatment, to predict the recurrence of cancer, and also we want to give the best treatment plan for radiotherapy treatment. Breast cancer in women is the highest cancer being diagnosed in Malaysia, and it is also the second highest death caused by cancer. Ethnic of Chinese is the most occurrent compared to other ethnic. Okay. To determine whether the patient have pneumonitis after the end of the treatment, doctor will look symptom related to the pneumonitis, or patient need to undergo pulmonary function test or undergo HRCT. So, by using big data, oncologists will know whether the patient have pneumonitis or not based on the treatment planning system. So, our specific objective is to compare the severity of lung toxicity based on patients that undergo mastectomy and lumpectomy. As we know that the volume of irradiation is not same for both conditions, and we also want to determine whether right side or left side of treatment for breast cancer has the highest number of lung toxicity. So, Daniel will talk about materials and methods.
Okay, moving on to the materials and methods that we are going to use in this project. So for materials, first, we're going to include a breast cancer patient that is treated in Hospital Chancellor Tuan Kumukris. The second one is treatment field size, and the last one is a specific dose, which is at 45 gray, 25 fraction for 5 weeks, either with boost or without boost. And then for methods that we are going to use is for sampling method, we're going to do data extraction from the breast cancer patient that are treated in HCTM from 2013 until 2018. Other than that, we're going to use big data modeling as a machine learning tool. For analytical method, we're going to use parametric test, which is t-test for both specific objectives. Okay, next is the workflow for this proposal. So I'm going to explain what is the inclusion and what is exclusion in this project. So the inclusion of this project, we're going to include breast cancer patient, and then we're going to include the female with any range of ages, the radical intern of the treatment, and the adjuvant radiotherapy. So the exclusion, meanwhile for exclusion is we're going to exclude the patient who had recurrence and who do not receive chemotherapy treatment. Okay, moving on. That is about workflow for this proposal. And then moving on to the Gantt chart. So Gantt chart, we have started this project since mid-August 2019, and now we are in the phase of reviewing the articles and selecting the best method for this project. And this project is expected to finish around August 2020. That's all from us. Thank you.